I'm going to present my strategic plan, which was about centralized telemetry. So the strategic goal that I was looking into was to convert from a decentralized telemetry monitoring system to a centralized telemetry monitoring system at Advocate Lutheran General within 2 years, and this was in light of increased safety events related to telemetry monitoring. We've had a total of about 10 within the past year, but all the hospitals within Advocate have also had multiple adverse events related to telemetry monitoring. So the stretch goal would be to convert all 12 hospitals within Advocate within 5 years. So a little bit of background information, like I mentioned, the reason for the conversion would be because there is an increased reports of adverse events related to telemetry monitoring, which can be due from not catching an arrhythmia, to leads falling off, to not having 24/7 monitoring, or even alarm fatigue, as there are lots of noises in a hospital unit. In light of patients being on telemetry and when things aren't catched or followed, the length of stay increases, which increases the cost of the hospital. They may have to be transferred to a higher level of care. And then this directly impacts reimbursement rates. It also causes patients to be dissatisfied as they are being moved from room to room to make sure that they can be telemetry capable. And right now, besides our ICU units, we only have 3 other units that have telemetry capability. So in order to transition from a centralized unit to a decentralized unit, I did a little bit of a SWOT analysis, which discusses strengths, weaknesses, opportunities, and threats. One of the strengths of the hospital is that it is one of the top 100 hospitals in the nation. Safety is a key, and we are a high reliability organization. The merger that we just had on April 1st with Aurora Health already has 3 hospitals that have a telemetry monitoring hub, so we can really learn from them. And then also, this would allow the nurses no longer to have to transport their patients to tests when they're on telemetry. A weakness was, like I mentioned before, there have been increased adverse events, and also that nurses have to accompany all telemetry patients. There's alarm fatigue, like I said earlier. There's bed alarms going off. We have private phones that we have to carry, and then the alarms from um, bed alarms or call lights, they all go off, and which in turn can cause alarm fatigue where the nurses do not hear when there's an alarm going off for an arrhythmia. And then this would also, the weakness is that we do not admit based on diagnosis. We have to admit based on if there's telemetry capability. And then there's also a need for standardization criteria for telemetry, which is mandated by regulatory bodies, and the regulatory body that looks over our hospital is DNV. When you look into opportunities, this would allow us to have telemetry capability on all the units. It advances our technology and wireless capability. Opportunity would also be that we need a job description for telemetry monitor technicians. And then we would also need to educate all our current employees and any new hires on telemetry that is centralized. One of the threats is that our competing hospitals, Northwestern Memorial, already has been functioning on a centralized telemetry since 2010. And then also Cleveland Clinic, a large multi-hospital system, has showed positive results and less technical errors. They've had 93% successfully resuscitated patients due to arrhythmias with the centralized system. Their notification has increased from 79% to 84%. So the numbers are good in saving lives of patients. So this is just a little strategy map of how things to look at. Our goal is to provide high quality, safe care to all patients, and with centralized telemetry, we could do that. Um, It'll increase patient satisfaction, it'll increase nurse satisfaction, it'll reduce safety events, and you can see how everything is interrelated within this map. The action plan would be to review all safety events related to telemetry. We would form a steering committee with nurses, managers, physicians, and clinical educators, that committee would help standardize the telemetry criteria. Working with human resources, we would figure out the hiring process for new telemetry monitoring technicians, and we would also have to work with finance to figure out the cost of the centralized hub. And then we would offer instructor-led classes from our clinical educators for all the nurses on the new telemetry standards, and then make sure all floors were able to place telemetry monitors. Our communication plan would be this PowerPoint. It would be a top-down approach. And then to disseminate the information to managers and committees, we would do it with our shared governance that would get our leaders of the nurses on board, physician meetings, manager meetings. We also have an SBAR email that goes out every time there's a new policy or product, so we could implement that. And then also up-to-date emails every week for RN Need to Know. I would have to minimize grapevine communications, as rumors would be negatively affecting this. And then I would definitely want feedback from the nurses and anyone else involved to see how the plan is going, if there's anything that we need to update or change. The evaluation plan would need to have a financial control, a feedback control, and a total quality management control. The financial control would be to see to balance the cost of the telemetry hub versus the adverse events cost. The feedback control model would be to compare all the adverse events and then within 1 year before the implementation and then 3, 6, 9 months post implementation. This will help measure and compare how our performance is going. And then the total quality management will help us work as a team. It will help see that we are decreasing costs and that we are increasing customer satisfaction, especially because patients don't have to be transferred from unit to unit, and we catch any arrhythmia faster with the centralized. So in conclusion, there is a positive outcome for safety. It'll decrease adverse events and quality care and patient. It will increase quality care and patient satisfaction. Because we are a high reliability organization and our goal is to have 0 serious safety events by 2020, converting would directly be aligned with that safety goal because it would decrease our adverse events. Thank you, and the references are to follow.